Hello, I'm going to be showing you all how to subcutaneously inject Ajovy. Ajovy is an abortive medication used to treat migraines. The reason that I was prescribed Ajovy is because I have very frequent migraines. I have a very high number of count. I don't know if I'm saying that right, but I experience a lot of migraines in a month, and so my neurologist said that at that point, because of the severity of my migraines, it makes sense to get placed on an abortive. I used to take Sumatriptin, but I experienced some complications with that, and I've tried other triptans, but they just weren't really working. And so this is Ajovy. It's an auto injector. It's produced by Neovance. This one specifically is 225 milligrams. And so I just want to show the process of it, just because I know it can be a scary thing. When you first open up the box, you're going to see the instructions here. I think it's important to educate whoever is going to be assisting you in doing this. You can do it independently, but I have my mom helping me out today because I didn't think I'd be doing injectables again. I used to be on Copaxone when I was first diagnosed with MS, but it wasn't proving to be effective for me. And I actually struggled in doing the injections myself. I found myself too nervous. I don't mind dealing with the needles and the pain, but it was too much for me. But we're trying this again with Ajovy because I do have a lot of migraines and they can be very debilitating. So this isn't as bad because it's a once a month injectable treatment. At least I don't have to inject every 48 hours. But when you open up the instructions, there's a lot of instructions, but it shows you, for example, where you'll be injecting. So you have 3 options. You could go for your tummy, your thighs, and the back of your forearm. If you're going for the back of your arm, you definitely want a helper with you. If you're going for your thigh, you can do it on your own, and your stomach as well. You can also do that on your own. But as I said, I am choosing to have my mom help me because there's also something weird about stabbing yourself. Like, it's just a weird feeling. I can deal with pain. It's just a very odd thing to have to inject yourself. So I'd rather someone else do it for me if that's an option. So I do greatly appreciate the assistance. And so underneath the instructions, you have the auto injector. It looks like this. You want to make sure that you check the expiration date. So for me, it says May 2028. So I'm in the clear. You want to check this window right here to see that the medication is in there. It should be a clear or yellow liquid. It is common to see an air bubble. I used to panic about seeing air bubbles, but the pharmacists say that it's just something normal. It just is what it is with the way it's packaged or prepared. And so after checking that, you want to make sure you have all your supplies. So we have alcohol prep pads to make sure I clean where I'll be getting injected. I have Band-Aids for the aftermath. My mom has gloves on. Make sure you have gloves. And we're using tissues in replacement for gauze because we actually don't have gauze, so I have to run out and get some next time. But oh yeah, and obviously you want to wash your hands before you inject. I guess you don't necessarily have to put gloves on, but I do that as a precaution. That's how I was trained by a nurse. I am immunocompromised, so I prefer to be as safe as possible. So my mom's pretty much ready. She's got her gloves on. She's opened the alcohol prep pad. And so, sorry. The first thing that you want to do, well, the injector is going to be looking out at her because she needs to watch the way the medication gets pushed through. When you push this down onto your skin, it has to be at a 90-degree angle. straight, not angled like this, like that, like that. You're just gonna go straight down. It's a little confusing with Ajovy because there's a 30-second time period that you have to wait to make sure that the medication is pushed through. Did I say 30 seconds or 30 minutes? 30 seconds.
30 seconds.
Okay. And so you're gonna hear 2 clicks. The first click is kind of to let you know, like, okay, the needle is, I think the needle is where it's supposed to be, or this is placed on your skin. And then the second click is when the medication is actually getting administered. And that will take approximately 10 seconds. And then I think you want to wait another 10 seconds just to make sure that the medication is inside your system. To be safe, I'm going to wait 45 seconds to a minute this time around. Hopefully it goes well. This is actually my second attempt. My first attempt was failed because I accidentally pulled the needle back after the first click and the medication spilled everywhere. So yes, hopefully it works. I have my mom here to support me, and I just wanted to show the process. So here comes the hard part.
Well, which area? Select the side.
So I'm going for my right side, my right thigh.
The area.
And then you have to, oh, okay, I got it. Oh, I think some medication leaked out. You want to like pull that straight down. Maybe I should have not been that rough, but okay, so I went there, but don't go here. That's an old injection site. That's an old injection site. So maybe right here. I don't like to look whenever I'm being injected, just because I feel like it's more painful. I tend to look away. The medication always burns me when it goes through, but it just is what it is.
Do I push that one?
Mm-hmm.
Sorry. You got this. You can do it. You can do it. Doing very good. I'm proud of you. You're doing very good.
So we're at 48 seconds and counting. Just waiting for a minute. And we're at that minute mark, so we're gonna take the needle out. And that was pretty painful, but we managed. Thank you. Oh, good. Whew. That was really painful.